What if your body could whisper secrets about your health that could save your life? Well, sometimes it does. Today, we're uncovering the 10 early whispers or signs of cancer that should not be ignored. Stay with us as we delve into the subtle cues that your body might be giving you and learn how to listen to what it's trying to say. Sign 1: unexplained weight loss. Imagine stepping on the scale and noticing your weight plummeting without any effort. While it might seem like a welcome surprise, it could be a silent alarm for something far more serious. Unexplained weight loss is like a mystery novel where the body is the scene of the crime. It's the story of losing 10 pounds or more without any changes in diet or exercise. This unexpected twist in your weight narrative could be an early clue to cancers of the esophagus, pancreas, stomach, or lung. But why does this happen? Let's unravel the science. A growing tumor can be like a greedy guest at a banquet, consuming nutrients and leaving little for the rest of the body. This can lead to weight loss that's both rapid and unintentional. And it's not just about the nutrients. Cancer can increase inflammation, leading to a loss of appetite and altering the body's metabolism. This metabolic mischief can make you feel full faster, even if you've eaten less than usual. So if you're shedding pounds without trying, it's time to play detective. Don't ignore this clue. It's worth investigating with your doctor. Early detection can make all the difference in solving the case of your health. Sign 2: persistent fatigue. Imagine a fatigue that's so profound it feels like a heavy blanket dampening your every move. This isn't the tiredness that a nap or a coffee can fix. This is something deeper, more persistent, and it could be whispering a warning of an underlying issue. We're talking about a fatigue that infiltrates your life, stealing your energy, and leaving you feeling perpetually drained. It's a type of weariness that lingers, unaffected by rest, and it's one of the most common symptoms experienced by those facing cancer. But what's behind this relentless tiredness? The answer might lie within the very life force of our bodies. Our blood. Anemia, a condition where your red blood cell count dips too low, is a frequent companion of cancer fatigue. These cells are the couriers of oxygen, and when they falter, so does your vitality. And then there's the matter of inflammation. The body's response to cancer can lead to a state of constant alert, battling not just the disease but also sapping strength from your muscles and mind. This ongoing fight can leave you feeling as if you've run a marathon with no finish line in sight. So, if you find yourself mired in a fatigue that's deep and unyielding, it's time to listen to your body's message. Reach out to your doctor, for this weariness may be a signpost, guiding you to early detection and intervention. Sign 3: fever. In the intricate dance of the immune system, a fever can be a sign of cancer, particularly blood cancers like leukemia or lymphoma. These cancers can cause fevers that rise and fall, sometimes peaking at the same time each day. But why does cancer induce fever? The answer isn't straightforward. Cancer cells can release substances that act like pyrogens, substances that tell the brain to turn up the heat. This biological thermostat adjustment is a signal, a beacon that something is amiss within the body. Kidney and liver cancers too are known culprits of the cancerous fever. Unlike infections, these fevers don't follow a predictable pattern and are often accompanied by other symptoms like weight loss or night sweats. So if you find yourself in the grip of a fever that doesn't wave the white flag, it's time to delve deeper. A persistent low-grade fever is a whisper from within, urging you to seek medical insight. While a fever alone might not mean cancer, it's a piece of the puzzle that shouldn't be ignored. It's a call to action, an invitation to uncover the truth of your health. Stay vigilant, and let's continue to decode the body's signals together. Sign 4: pain. Pain, an unwelcome intruder in our lives, often arrives without an invitation. It's a signal, sometimes sharp and clear, other times a dull ache that whispers of deeper troubles lurking beneath the surface. In the quiet corners of our body, pain can begin as a mere murmur, only to crescendo into a relentless roar. When pain persists, when it defies explanation and resists the usual remedies, it demands our attention. This is especially true when it comes to bone cancer, where pain often makes an early entrance, refusing to be ignored. But pain's origins are as diverse as its character. It can be the direct result of a mass pressing against nerves, organs, and other structures, or it can be more insidious, the result of chemicals released by the cancer itself, setting off a chain reaction of discomfort and distress. And let's not forget metastasis, cancer's treacherous spread. As it travels from its birthplace to distant lands within the body, it can colonize and conquer, bringing pain to new territories. So if you find yourself grappling with a pain that's both unexplained and unrelenting, it's time to pause and listen. Reach out to your doctor, for this pain may be a sentinel standing guard and alerting you to the need for further investigation. While pain alone is not a definitive sign of cancer, it's a symptom that should never be dismissed. It's a call to action, a signal to seek out answers. Sign 5: skin changes. Your skin, the sentinel of your body, often holds the earliest tales of change. It's a canvas that can reveal the most subtle hints of a deeper narrative unfolding within. Let's paint a picture of skin changes, the kind that might go unnoticed in the daily rush of life. These changes are not just about new moles or spots, they're about the hues and textures that suddenly don't belong. Jaundice, reddened, or yellowish skin can signal liver or kidney issues, while increased hair growth or new lesions might point to skin cancer. And when it comes to melanoma, the deadliest form of skin cancer, it's the asymmetry, border irregularity, color variation, diameter, and evolving nature of moles that raise red flags. These signs, known as the ABCDEs of melanoma, are the whispers of warning that call for a closer look. So, if you notice a patch of skin that feels rough or dry, a mole that evolves, or a sore that lingers, consider it a message from your body. It's time to seek the wisdom of a dermatologist, for these subtle shifts in your skin's story could be early chapters of cancer. Sign 6, change in bowel habits or bladder function. Now let's turn to the rhythms that govern our daily lives, the routines of our bowels and bladder. When these rhythms skip a beat, when constipation or diarrhea become the new norm, or when the size of your stool changes, it's time to listen to the beat of a different drum. These could be early signs of colon cancer, a silent melody that plays beneath the surface. And what of the waters within? When pain accompanies urination, when blood taints the urine, or when the call of the bladder becomes more frequent or less so, it could be a sign of bladder or prostate cancer. These changes in the flow of life shouldn't be ignored, for they can be the ripples of a disturbance deeper within. So, if the routines of your body alter, if the whispers become persistent calls, it's time to seek the harmony of health once more. Reach out to your doctor, for these changes in routine may be the early beats of a warning drum. Sign 7, sores that do not heal. Consider the sores that overstay their welcome, those that persist beyond the usual healing time. They may appear innocuous, a minor character in the narrative of our skin, but they hold a deeper significance. These stubborn sores, especially when they refuse to heal or recur after healing, can be harbingers of skin cancer. Basal and squamous cell carcinomas, the common culprits, often begin as unassuming guests. They may itch or bleed, masquerading as benign intruders, yet they carry a tale of caution. A simple rule of thumb: most sores should heal within a week or so. If not, it's a chapter that demands attention. And what of the sores hidden from view, those within the mouth or on the tongue? They too speak in hushed tones of potential danger. Oral cancer may manifest as a white or red patch, a sore that doesn't heal, signaling its presence in silence. So, if you find a sore that lingers like an unfinished sentence, seek the expertise of a doctor. It's a sign that warrants a closer reading, an exploration for underlying truths. Sign 8, white patches inside the mouth or white spots on the tongue. Now let's turn the page to the muted marks within our mouths. White patches that emerge without fanfare, often unnoticed in the daily dialogue of life. These silent sentinels, known as leukoplakia, are the body's cryptic messages. They form on the gums, the insides of the cheeks, and the bottom of the mouth. While most are benign, some patches bear the early signs of cancer, standing guard next to areas that could herald oral malignancies. And amidst the white, there may be speckles of red, a condition called erythroleukoplakia. These mixed patches are more likely to become cancerous, a whisper of warning that should not be ignored. So if you discover a patch that feels out of place, a spot that doesn't belong in the narrative of your mouth, it's time to seek a professional's gaze. These marks are the subtle signs, the quiet clues that call for a discerning eye. Sign 9, unusual bleeding or discharge. Imagine a thread that bleeds color, a sign that something within is amiss. Unusual bleeding or discharge is one such thread, a subtle yet alarming signal from our body. Whether it's blood in the stool hinting at colon cancer, or an abnormal vaginal discharge possibly pointing to uterine or cervical cancer, these signs are the body's way of raising the alarm. But why does this happen? Cancer can disrupt the delicate balance of our tissues, leading to bleeding or discharge where there should be none. It's a stark reminder that our bodies are complex systems, and when one part falters, the effects can ripple through the whole. So, if you notice a change in your body's patterns, a new bleeding or discharge that's out of the ordinary, it's time to follow that thread. Consult with your doctor, for these signs are the body's plea for attention, a whisper of potential danger that deserves to be heard. Sign 10, lump or thickening in the breast or other parts of the body. Now let's explore the whispers of hidden lumps, those silent sentinels that rise beneath the skin's surface. A new lump in the breast or elsewhere in the body can be the first whisper of cancer's presence, often detected through touch rather than sight. These lumps, often hard and irregular, are the body's cryptic braille, a message to be deciphered with urgency. They may be painless, yet they speak volumes, urging us to seek understanding and care. But not all lumps spell trouble. Many are benign, mere footnotes in the story of our health. However, it's the possibility of malignancy that compels us to act, to transform worry into action. If you discover a lump, a thickening that feels out of place, don't let fear silence you. Reach out to your doctor, for this whisper could be a turning point. A chance to catch cancer in its early stages and alter the course of your story. Remember, these signs don't always mean cancer. But if you notice any of them, taking action by seeing a doctor could save your life. Early detection is key. Stay informed, stay vigilant, and take care of your health.